Hello, I'm Dr. Maurie Markman from the University of Texas MD Anderson Cancer Center, and I want to briefly discuss a very interesting and important paper that appeared in the Journal of Clinical Oncology in June of 2008. This paper from the Childhood Cancer Survivor Study looked at the question of the long-term risk of the development of osteonecrosis in adult survivors of childhood cancer. It has clearly been recognized that osteonecrosis is a long-term complication associated with radiation and steroid therapy, but the incidence of this side effect in long-term survivors has not been well understood or studied. In this particular paper, the researchers reported a 20-year cumulative incidence of this side effect of treatment that involved, this was a total of 42 cancer survivors involving 78 joints among over 9,000 patients who were enrolled in the Childhood Cancer Survivor Study. This gave a cumulative incidence at 20 years of 0.4% for the development of osteonecrosis. This study is important for several reasons. First of all, it demonstrates that while there is a risk of osteonecrosis, the risk is rare with a 20-year follow-up, and clearly this incidence is higher than would occur in the normal population, but again, the risk is low. And second, I think this is a very important study because it demonstrates that both the need for very long-term follow-up for these complications of treatment, and the fact that although there may be a concern with these long-term complications, the risks may be relatively low, as seen in this particular study. Clearly, as children are long-term survivors, and adults who have developed cancer at a relatively young age, who now may be living with cancer as cancer survivors 10, 20, 30, or even 40 years after initial diagnosis. These long-term survivorship studies become extremely important, and following these long-term survivors to know both the incidence of these complications as well as optimal management for these issues when they develop becomes a very important part of a research agenda for the clinical cancer research community. I thank you for your listening to this report, and I would encourage you to read this paper that appeared in volume 26, page 3038 to 3045 in the Journal of Clinical Oncology.